Hello, friends. Today I would like to tell you about the historical origins, symptoms, and progression of schizophrenia in more depth. Schizophrenia is a serious, lifelong mental health disorder that affects people's mental health. Our story goes back to the 19th century, specifically to 1887. This year became important when the German psychiatrist Emil Kraepelin used the term to describe schizophrenia. Kraepelin used the term to describe symptoms such as distortion of an individual's perception of reality, disorganized thoughts, emotional changes, and social withdrawal. Now, let's get to know Lisa, the main character of our story. Lisa is a young woman who has recently started to exhibit strange behavior. Her friends and family notice that Lisa is not the same as she used to be and often speaks in strange conversations. In Lisa's room, her family becomes concerned when they see her drawing strange symbols and writing on the walls. Lisa's symptoms worsen over time. She has difficulty communicating with the outside world and seems lost in her own inner world. She vacillates between reality and imagination and occasionally talks to herself. One day, Lisa tells her family that her thoughts are taking over her and that she is trapped between reality and her imagination. Her parents take Lisa to a psychiatrist. The doctor determines that Lisa is showing signs of schizophrenia and needs to be treated. Lisa begins treatment with antipsychotic drugs and therapy. The treatment process can be challenging, but Lisa's family and doctors support her. Over time, Lisa's condition begins to improve. Medication and therapy help her to reconnect with reality and resume her daily life. Surrounded by support and love, Lisa learns to cope with schizophrenia. But let's not forget that not every schizophrenia story is the same. Each person's experience is different, and the treatment process is individualized. Now, having summarized Lisa's story, let's delve a little deeper into the historical origins of schizophrenia, its symptoms and treatment options. Schizophrenia entered the modern psychiatric literature through the work of German psychiatrist Emil Kraepelin. In 1887, Kraepelin defined schizophrenia with symptoms such as distorted perception of reality, disorganized thoughts, mood swings, and social withdrawal. However, schizophrenia-like symptoms can also be found deep in history. For example, in antiquity and in the Middle Ages, mental disorders were referred to by different definitions, and the treatment of these conditions was attempted in different ways. Symptoms. Schizophrenia is a complex mental disorder and is usually divided into 4 categories: positive symptoms, negative symptoms, cognitive symptoms, and emotional symptoms. Positive symptoms relate to a detachment from reality and include symptoms such as hallucinations, e.g. auditory or visual, delusions, beliefs that are not real, and thought disorders, e.g. disorganized or irrational thoughts. Negative symptoms show deficits in the individual's normal functioning. These can include symptoms such as emotional dullness, social withdrawal, lack of speech, and loss of motivation. Cognitive symptoms show impairments in an individual's thinking processes. Lack of concentration, memory problems, and difficulties with thought organization fall into this category. Emotional symptoms include abnormalities in emotional expression and experience. This includes limited emotional responses, inappropriate emotional responses, or excessive emotional responses. Treatment options. Treatment of schizophrenia usually requires a multidisciplinary approach and should be individualized. Treatment usually involves a combination of psychotherapy, medication, and supportive services. Antipsychotic medications are used to manage positive symptoms and can help regulate thoughts and perception. However, it is important to select the appropriate antipsychotic medication and adjust the dose for each patient. Psychotherapy can help learn to cope with the effects of the illness and improve social skills. Supportive services such as family therapy and support groups are also important. Rehabilitation and supportive services can help patients improve their daily living skills and reintegrate into society. This is an overview of schizophrenia, and each person's situation may be different. Treatment will vary depending on the individual's needs and symptoms. It is important to always consult a specialist. With this short story, we have covered the history, symptoms, and progression of schizophrenia in more detail. Remember, if you have any concerns about mental health, it is important to consult a health professional. Have a healthy day.